You may have heard of the NIPT, but what you may not know is it does a lot more than just tell you the baby's gender. My name is Dr. Mitchell Bertrand, and today we're going to go through what the NIPT is, why it really matters, and in the end of this video, I'm going to share some stories about how this test has affected some of my patients and where this technology is going in the future. So, why does the NIPT matter? For those of you that don't know what an NIPT is, what it stands for is non-invasive prenatal testing. So, generally, when people get pregnant, a lot of people get intimidated by the amount of tests that we do. And I like to remind people that every test we do, if it's blood work, if it's an ultrasound, or any other test, all we're really doing is getting really creative and finding ways to tell you that everything's okay. What this test does and what the tests have done beforehand is to try to make sure, hey, does this baby have an increased risk for something like Down syndrome or any other similar genetic disorders? So the reason why this really matters is if you look at how often this happens, if you are 20 years old and that is young, right? The chance of genetic disorders are low. And as people get older, those chances are higher, but there's still, even when you're young, it still exists. So for example, if you're 20, your chance of having a baby with Down syndrome is 1 in 1,250, and your chance of having any sort of chromosomal disorder is 1 in 122. That's more than people like to talk about or admit. As you get older and you are about 40, that risk goes into to about 1 in 86 for Down syndrome and 1 in 40 all around. So being able to tell a mom that their baby's okay, or being able to find something that's wrong before you deliver, is something that is really important. So previously, we'd have these tests, and these tests that we do is they check different markers in the blood. So one of the common ones is something called a quad screen. And the quad screen, for example, was a decent test. It would catch 81% of these babies with Down syndrome, for example, but you're missing 20%. And then on top of that, you could not do it before 15 weeks, which is in the second trimester. There's something else called the sequential screen, and there's this other tests where they mix with ultrasounds, and they would try to give you a result, but they were not as good, and it usually required more time to get those answers. So in came this test called free cell DNA, which is what we're doing, which is what the NIPT is you're basically taking blood cells that are coming from the baby's placenta that are flowing through the mom's veins, which really sounds science fiction to me. But you're testing in your blood the baby cells. And this is still a screening test because there's a difference between a screening test and a diagnostic test. And we'll talk about that in a second. But when we're looking at these blood cells, it will then tell us as early as 9 to 10 weeks, we're able to test to see if this baby has Down syndrome and the sex of the baby and a few other things that we're going to get into in a minute. But it allows us to find answers a lot more quickly and a lot more accurately. So the amount of, for example, cases of Down syndrome that it catches is 99%, which is a lot better than 80%. And mixed with the different other testings that we do, it allows us to provide a lot more reassurance. And if there's an issue, it lets us address it at a lot earlier of gestational age, because the whole idea is to figure out when this is happening, to be able to deal with this accordingly. And a lot of people, I get pushback saying, hey, if I have a baby with special needs, like I don't want to abort, why am I doing the testing? What I usually respond to that is, we're not doing this based on your specific action, but I usually remind people, if you have, first of all, is whatever your choice on what you want to do. But for those people that tell me they would not do an abortion, I would ask you, if you had a baby that had special needs, wouldn't you want to know earlier so you can get the appropriate resources to help that child? So I usually reframe it that way, that whatever your choices are, the earlier we find out, the better. And it gives us a lot more options. So like I said previously, this is a screening test, and the screening tests tend to be something called non-invasive versus invasive tests. So imagine non-invasive meaning it either takes some blood, you do an ultrasound, where an invasive test can actually cause problems or it requires a procedure. So previously, before we did the NIPT, imagine a lot of people call advanced maternal age 35, which it is, but the reason we call it 35 advanced maternal age is because at 35 years old, they thought at the time, which is about accurate, your risk of Down syndrome is about 1 in 250. They thought the risk of doing an amniocentesis, which is putting a needle in the belly with an ultrasound and grabbing amniotic fluid, the risk of breaking your water or miscarriage was about 1 in 250. We now found that that risk is actually lower, but people were automatically doing these more invasive testing because of the increased risk. So those tests are really important, especially if you see an issue. But imagine we are doing a lot of invasive testing for people who now don't really need it. Because if I told you, and we'll go through this in a second, if your risk went from 1 in 250 to less than 1 in 10,000, then that would be a huge help. Well, most people would not choose to do that diagnostic testing. The American College does say, though, anyone who does want a diagnostic test should be given the option. So, but for most people, that is a huge way for us to tell you that everything is okay. So next, we're going to go through a sample report that I want you guys to see here, okay? This is a test through Natera. This is a sample that they provide on their website. This is not a real patient, but what I do want you to see here is when you're given these reports back, you'll see it says the name on top. Here it says Jane Doe, and here it says Jane Doe and the date of birth. And you see that this person, the sample person, is 37 years old and they're 11 weeks pregnant. And the way this test is reported is it shows a few things. It shows the risk. It'll say high risk or low risk, right? This is a screening test, so it will give you a pre-test and a post-test probability, which is just saying, hey, what is the chance we think you have Down syndrome based on your age? And if you look here, this result is low risk. And if you look at the risk of Down syndrome for this patient was 1 in 152. That's quite high before the test. So if you look after the test, the risk goes down to 1 in 10,000. That is a lot lower of a risk. So you can see how this test can really be helpful in getting information for patients to make a decision for them. The other things I want you to notice here, it says the sex of the baby, and it also says the fetal fraction. So for where I was talking about before is when you're looking at the test previously, right? I said you needed to be at least 9 to 10 weeks. And the reason why is you need enough cells from the baby to be flowing through your bloodstream to be able to give you results, if that makes sense. So that is typically how this is read. And if you notice, there's other things here. It's called monosomy X. This is also looking for issues with showing the issues with the sex chromosomes. And that's something called Turner syndrome if you're missing an X chromosome. And then there's something called triploidy, which is imagine 3 sets of each gene instead of 2 sets. The next thing, if you scroll down further, you'll see this other thing that says sensitivity and specificity. And if you look in this test, they're all almost 99%, at least for the Down syndrome, which is what we're most commonly. Same thing with like the sex of the babies here. But another thing I want you to notice is there's something here called positive predictive value. And if you see for trisomy 21, it's 95%. The negative predictive value is less than 99.99%. These values change depending on your age, because the way that these values work is, like I said, if you're 20, the chance if you're walking around the population that your baby has Down syndrome is 1 in 1,250. Your chance of one of those as you turn 40, and if it goes to, let's say, 1 in 86, the chance of grabbing someone and being right is higher. So as you get older, because there's something called an incidence, the more people are of that age, right? Then when there's more people of that age, then the chance of being right is higher. But what the other really important thing is here, notice the negative predictive value. The chance the test is negative is actually negative is really high. So that is typically what these tests look like, and they tend to be very helpful for patients. There's 2 other things now that are also really helpful that they've come up with. The first is something called RH, and I'll make another video on what that actually is, but you have a certain blood types, right? You may have heard you have A blood, B blood, O blood. But there's another thing is if it's positive or negative, right? And what's nice is for people who have negative blood, for example, I have O negative blood. If a mom has a negative blood type and the dad has a positive blood type and the baby in their belly has a positive blood type, when there's mixing of blood that happens with delivery or bleeding, what can happen is that the mom's body can attack the baby. It rarely happens in the first pregnancy, but it can happen afterwards. So there's this thing that they came up with called RhoGAM, which again, I'll make another video about completely, but we would give mom this vaccine that would cover their cells of the baby so they would not attack the baby. Recently, actually, there was a RhoGAM shortage, and that because of that shortage, what happened was we did not have enough RhoGAM to give people. And because through this same test, they're able to test for because they're able to test for the blood type of the baby, it let us know if the baby had negative blood. The next thing is something called microdeletion. So there's other syndromes, like for example, DiGeorge syndrome that they're able to test for, but those tests are not routinely done yet. Some people will do them, but if you look, I'll pull up on the screen is if, let's say the risk before the test is 1 in 2,000 of DiGeorge syndrome, the after risk is 1 in 12,000. And there's a few other ones that it's reassuring, but it's not as powerful as making as the change for example, Down syndrome. But those are things that are happening in the future, which is really exciting. So I want to now go into 2 stories on how this has affected some of my patients. So I had a patient come in and she did this test. And this test, what happened was they did the NIPT test and it came back for something called monosomy X, which is Turner syndrome. So to be clear, when you have the typical phenotype, which is what a person looks like with Turner syndrome, like in general, imagine you have they tend to actually have high IQs. They tend to be normal intellectually. They tend to be short, web-necked, and they can have some heart issues, right? So this was something that was concerning for the mom. So they went and then did that diagnostic testing called an amniocentesis. What was interesting about the amniocentesis, it came back negative. So we started wondering, okay, why did this come back negative? The interesting thing that happened was when they tested the mom's blood, the mom had something called a mosaicism for Turner syndrome. So it was actually the mom's genes that they picked up that she had no idea. And basically what a mosaicism is imagine if you had, let's say, half the genes were XX, which is for female, and the other half were XO. They have both bloodlines, but it's not always 50-50. In her case, it's probably more like 95-5 because she had none of the physical features of someone with Turner syndrome. It was actually really helpful for the mom to know because when people have that variant, there's a higher chance that they go into menopause earlier. So that changes the way you counsel them for things like family planning. That was super helpful to know. And that actually, by the way, she delivered a beautiful, healthy child. And we would have never had that information if we didn't do this test. The next story I'm going to go through is a little kind of crazier, in my opinion. Had a patient, she came in, she was 23 years old. She had no symptoms with her pregnancy, everything was healthy. And we did this test, and what it came back for was something that was really interesting. The results said, hey, I have DNA, but it's not from you, the mom, or from the baby. So when this happens, you go, where did these cells come from? So we sent her to the NIH, which is the big research facility, to get a full workup. And it turns out that this patient had a 9-centimeter mediastinal mass, which is like a mass over here, and it was a lymphoma. And it turned out to be actually pretty aggressive. But this patient had no symptoms at all. She had no idea this was happening. We sent her to a high-risk unit, and she ended up delivering a healthy baby, actually receiving a little bit of chemo during the pregnancy. And it ended up being a very aggressive form of cancer, but because they caught it, they were able to treat her, and now she's in complete remission. So literally, by being pregnant and receiving this test, it saved her life, which is an incredible story. And now there's a company called Grail who has a test called Galleri, who now is using the same technology in an NIPT to detect cancer. And there are many cancers that are very hard to detect. For example, ovarian cancer. If you did an ultrasound for ovarian cancer, your risk of your ability to catch that with an ultrasound, people go, why don't we do an ultrasound? Is 17%, 17. With that test now, it's almost as high as 86%. There's a huge gap. Mind you, it's not perfect and there's a lot of work that needs to be done here, but this is the future of where this testing is going. And I'm really excited to see where this goes in the future. And if you're on your pregnancy journey and you want to know the next steps, click here and watch the next video. Have a good day.